It is a Men's Health Monday. One of my favorite segments where we get to talk to this guy, Dr. Michael Lutz, founder and president of the Men's Health Foundation, in studio with us. Doc, how you doing, my friend?
Oh, great to be here. Appreciate it.
Absolutely. So, Doc, we were just talking with Marie Osborne about Costco and selling the GLP-1s and the weight loss drugs. Just what is your overall look at these weight loss drugs, the amount of people that are on them, the pros and cons of them? Not to break it down, but just from where you sit, your overall look at them.
Well, there's nothing but good news. I mean, when you think about losing weight, the benefits have been shown to be huge. Cardiac-wise, reduction in malignancies, overall improvement in joint durability, stability for people, their mobility increases, their exercise tolerance increases. So there's been so many benefits. The one thing you have to be careful is some of the loss of the muscle mass as well during weight loss. So you have to really maintain your muscle mass by doing weightlifting exercises.
Just my personal experience using them, and I'm not on it now, but when I was on them, I lost the weight. My back felt better, my hips felt better, my knees felt better. There were some side effects that I dealt with, but overall, I felt better.
Yeah, there really are some short-term and long-term gains to be had by these medications. The real question is how long do you stay on them? Do you wean off of them? If you're a really good responder, a high responder, if you lose 35 to 50 pounds on these medications, you're probably going to be a high responder as far as gaining weight back when you discontinue them.
That's me too.
So you have to be really careful on the discontinuance and talk to your doctor about how to wean from these in a careful fashion.
All right. One of the things I wanted to discuss with you this week, I wanted to focus on testosterone.
Sure.
Some of the pros and cons, and to be honest with you, I can't even remember the last time I got my testosterone checked. Is that a test that guys should be doing?
Yeah, I believe as a young guy, it's one of your baseline tests that should be done. But the thing I want to caution most young men about is it can be dangerous. And let me just say this. Testosterone fluctuates in what we call a diurnal fashion, and it peaks at 5 a.m. And so if you're going to get your testosterone check, get it drawn early in the morning. After about age 45, that fluctuation kind of goes away and you can get it drawn any time of the day. If you start testosterone replacement because you truly need it, you need to be watched, you need to be monitored. They need to talk to you about it. It could diminish your fertility potential. Can't use it as birth control, but it could diminish your sperm counts, and you have to be careful. If you're not worried about that, go ahead and you can go on it. But you need to be monitored because it can also stimulate your bone marrow and get your blood a little bit on the thick side.
Yeah, it's not a toy. It's not something that you just decide, hey, I want to buff up a little bit here. Or I want to take some testosterone.
Yeah, believe it or not, it's actually considered a controlled substance. A lot of guys use these testosterone drugs to build up their muscle mass. And, a lot of our sports heroes have been caught using testosterone in excessive amounts because it can actually improve their sporting capabilities.
Talk to me about how one needs to figure out whether they need to take that or not. Is that a blood test you would?
Yeah, real easy. Just get a blood test where they measure what's called your total and your free testosterone. The free testosterone is that portion of testosterone just floating in your bloodstream, not bound to anything. That's the one we really want to know, because if you have a low free testosterone, it means you have a low amount of testosterone, giving you that sense of libido, wellness, getting rid of that fatigue, helping you build your muscle mass, and you may need to go on some type of replacement therapy.
What are some of the cons of that?
If you're on it and you don't need it, then you actually start shutting down your own mechanism. Your testicles will start to shrink, and you may not ever respond if you go off of the testosterone, and then you're going to be dependent on it forever.
Yeah, that's something you really don't want to have happen to you.
Not the right game plan.
No, not at all. So it is an important topic, and there's a lot of guys that you hear about testosterone. A lot of guys go to the gym and they maybe take a testosterone, or how do you? What is it? Is it a? How do you ingest it? How do you take it?
Great question. There's a lot of ways you can take testosterone nowadays. The most common way is actually through injections, but you can also get oral supplements that are testosterone drugs. You can also do topical, which are gels and creams. And then there's also a nasal insufflation that you can put it inside your nose, like a nose spray. So there's so many ways you can receive testosterone supplementation. There are also some medications that will also boost your testosterone levels, so you don't necessarily have to go directly on testosterone per se, such as clomiphene citrate. And we've used that for many years for fertility patients.
Incredible stuff there. Dr. Michael Lutz, Men's Health Foundation. This is a Men's Health Monday here on 760 WJR. And October, I wanted to get to this too because October is, did you guys hear that or was that just me? Oh, sorry, I had something in my ear. October is Breast Cancer Awareness Month. And a lot of guys don't think that that is something for them. But as you say, more and more men are being affected by breast cancer, correct?
Yeah, there's only about 1% of breast cancers that are male. But the incidence of breast cancer in men has gone up by almost 300% since 1990. And we're seeing breast cancer in men in 60 and above. So the thing is that breast cancer isn't a negligible disease, and it also is something that can exist in men. And, we always say that, there's a 1 in 8 incidence of prostate cancer, there's a 1 in 8 incidence of breast cancer. And if you look at the statistics for breast cancer and prostate cancer, they directly parallel each other. And so my comment to most men is this is the month where you support the women in your life. This is the month where you give kudos to the women that you appreciate, and you make sure they go out and they get their screenings and you support those women.
No doubt about it. And for a lot of guys, look, everybody knows somebody that has cancer, sadly, and it is something that I think is happening so much more. Maybe it's my age, I don't know, but like the amount of people that I hear have cancer or are dying or something they're dealing with, man, getting old is not fun.
No, and you got to think of the genetics too. So if you have a family history of prostate cancer, you have an increased risk of getting it yourself. The same thing for breast cancer. And here's the crossover. If you have a family history of breast cancer, the men have an increased risk of prostate cancer and vice versa. So it's really important to understand that these diseases are somewhat linked in their genetic risk. And so you have to pay attention to your family history. And like I always say, you have to pick your parents carefully.
No doubt. And I'll tell you this too, Dr. Lutz. It is so important, and one of the things about this segment that I hope people are encouraged to do is go get checked out. When you hear us talking about whether it's prostate cancer or testosterone, or we talk about a number of different things here during this segment that we've done since July, since we started, hopefully it triggers something in somebody to go get checked out. Maybe they haven't been to the doctor in quite some time. Go get checked out.
Yeah, screening saves lives. And the one thing I give kudos to women about is when the U.S. Preventative Services Task Force tried to change the guidelines for screening, the women said, nope, not going to do that. It's our way. And the women changed it back to the way it was for screening. The men have stood silent, and as a result, we've had the worst guidelines ever for prostate cancer screening, and we are going to do everything we can to change it to the way it needs to be done.
Love that. Doc, in the remaining time, what do you think about the Tigers? I know you're a big Tigers fan. Do you think they have a chance to win this series, a good chance?
See, I still live in the world of the 68 Tigers. They're still my heroes.
Can you believe, though, 68, 84, and nothing?
Nothing.
I mean, I cannot.
What happened?
1984 was a long time ago.
Yeah, if I can still remember that game, yeah.
Oh, my gosh. So 2 games here in Detroit. The idea that fans, a lot of guys will get together, how good is it health-wise to be a sports fan?
It is the best because anything that brings guys together and be socially interactive is the best thing ever.
I think there's health benefits for this. It's such a great thing. Maybe we'll talk about that next week. The health benefits of being a sports fan. Dr. Michael Lutz, we appreciate it, my friend. Check it out. I don't know what's going on with my headphones. I apologize. Men's Health Foundation, Michigan. What's the website? Sorry, I'm so discombobulated.
The Michigan Men's Health Foundation.org.
Michigan Men's Health Foundation.org. Look at that. Dr. Michael Lutz, Men's Health Monday, 760 WJR.